Having a seriously ill child is bad enough, but imagine being isolated from big city hospitals. Who do you call? Well, you contact Little Wings.
Julian Bertoni has flown the biggest planes all over the world. But today, he's not just the captain. He's also responsible for checking the fuel and making sure the propellers are well oiled. It's all in a day's work preparing for takeoff on an important mission.
How does it compare to a big airliner?
Oh, it's fantastic. A great little rocket ship.
After 11 years flying for Virgin Australia, COVID steered Julian in a new direction.
And the extended sort of stand-down period that we all went through resulted in me having a career change, and I'm now a mortgage broker.
The stand-down gave flight to another new opportunity. Weekends spent donating his time to Little Wings, a charity organisation which transports seriously ill children from the bush to the big city hospitals.
It's just about helping out other people, which is perfect.
If having a seriously ill child wasn't enough, worrying about getting the medical care they need is just another burden for so many parents living in regional and remote areas. So you can imagine when one of these planes arrives to pick you up and fly you where you need to go. It's a special ride.
When Zach got sick...
At the tender age of 10, Zach's battling eye cancer.
Try to be positive, always try and smile.
Over the past 2 years, he's been through more than most of us could ever imagine.
After my first treatment, I was diagnosed again, and then they had to take my eye out. But before the second chemo finished, I was diagnosed for a third time with rhabdomyolysis, with the same cancer.
You know, what do? We appreciate each other and having good times together, and just let Zach know that we're all in it together and we're walking side by side with him, and we'll get through it.
Zach's mum, Rebecca, says the family's relied on Little Wings to fly them back and forth between Sydney and Canberra every week for most of this year.
Little Wings has been a real saviour in that regard, that it's just taken this weight off us and really made a huge difference.
And always a happy face to greet us. They're always really nice, and they'll help us get from one place to another. It's just amazing.
As amazing as the connections made between the pilot and his passengers.
We had a little person who had been in hospital for a very long time and had his arm amputated, and we got to fly him home for his Year 6 farewell and formal. And he said, you know, I'm a bit nervous. He said, but I am flying in my own jet.
Claire Pearson is the Little Wings CEO.
One of the pilots actually said to me that whilst it was a big mission flying to LA and Dubai and all these fancy places, he said in some ways it's a bigger mission here at Little Wings.
A mission that is growing by the day. Today, we're on board with 4 specialist doctors bound for Tamworth.
The disparities between, metropolitan Sydney versus out in the bush, regional, rural or remote, is like going to another country, almost.
The doctors contacted Claire during lockdown, but this time they needed help.
We had one of the specialists at John Hunter Children's Hospital reach out to us and say, can you fly me out to areas because my patients have respiratory issues and they can't come into the hotspots. And actually my first response to them is, doesn't someone else do that?
Having always depended on commercial flights, Dr. B and his team, who fly in and out of the specialist clinic, were left stranded.
It's not just the doctors who would miss out, it's the patients at the end of the day.
Without them, we would have to cancel more than 80% of the clinics or do them completely via telehealth. Yeah, I think I would say they were a lifesaver for not just the region, but also the clinic itself.
What's on the other?
As a neurologist who needs to physically examine her patients, Dr. Julia Thompson hates to think what could happen if Little Wings didn't come to the rescue.
121 people are booked over the next 3 days, and that's between just 3 of us. So that's what we would cancel. That's 120 patients who'd be waiting.
Good boy.
And the parents of those little patients know just how lucky they are. Maria would have had to drive more than 3 hours with her 15-month-old son just for an appointment.
It's not just a commute. If you have to do it, you do it. It's your son's health, right? All of the added stress of like traveling with a baby in a car for a long period of time by yourself.
Danielle's daughter needed urgent specialist care following a rugby head injury in June.
Are you from Tamworth or from...
Look, I think it's incredibly important. You're not in a position, especially at the moment with COVID, to be able to travel to a specialist in Sydney or Newcastle.
In what kind of...
These are essential services these days.
Not sure.
Little Wings, what did you know about them?
Absolutely nothing till COVID times, truth be told. And I'm ashamed to admit it, but it was actually the service that came to the rescue.
So we're flying at least 4 times a week, up to 12 doctors a week, out to regional areas to deliver these services.
They're all journeys within a journey, but the end goal is always the same: lending a hand or a wing to make life a little easier.
And we often hear parents say that they felt held when they were in the plane. It was a moment to just breathe in amongst all the chaos.
If you're not in a big city and you don't have one of these amazing hospitals on your doorstep, Little Wings is that link that connects and makes it more fair for more Australians, I think.
What incredibly important work. That was the best story of the day.